Okay. Good evening, everyone. I see that some people are still entering the room. So first, thank to the ECRA board and the General Assembly to have elected me as the next ECRA president. So it will be a great pleasure to work with a new team, or a team that we know already for a long time as well. But also I look forward to the future of the European CMT Research Association. So for the opening, I have prepared some slides to... can you show the first slide? Yeah. Okay, so you all convene here in a very nice old building. So it's, I think it's from the 16th century. And it was basically first a kind of monastery and then a school for economics. And it's still a part of the University of Antwerp. And here you can follow law, you can follow social sciences, languages, economy. So that's the campus where you are located today. The other campus where we are located are outside the city, so in other type of buildings for labs. Next slide. It doesn't work. Doesn't go forward. Doesn't go. Yeah, okay. So I think you will have to help me because this box doesn't work. So I would like to mention these three famous doctors who really welcome you all at this conference. And what is exciting, as you can see on the, I don't know if you can, yeah, the pointer only, yeah. So anyway, sorry? So that's something we have to fix. So we need a pointer here. So anyway, so you see that Jean-Martin Charcot was born in 1825, and Howard Henry II died in 1925, and we are today in 2025. Okay. Next slide. Can you put next slide? So this we have to fix. This is not okay. Next slide. Wrong direction. So I see three people there sweating, so and they make me nervous. Okay, now it seems to work. Okay. Then other people who are very important to mention to young people, because actually at this meeting we also have many young scientists and clinicians here. So P.K. Thomas, who some of us have known, of course, Anita Harding, of course, and then unfortunately Peter James Dick also passed away earlier in the summer, I think. So that's also people who have basically classified all the types of CMT into the forms that we know based on clinical classification, pathological findings, electrophysiology, and genetic studies. Then I would like to also acknowledge Daniel Tanes, the former president of the European CMT Federation, but I mean the honorary president, who also passed away this year, and I just want to remember him by thanking him a lot and for all the work that he has done. I think without Daniel, there would not be Ingolf, there would not be Filippo and other people involved from the patient side then, in many countries in Europe who basically created the European CMT Federation. And yeah, so I would like to have a few minutes, 2 seconds of silence for him. Thank you. Okay, then we thank you very much. So everything started with Daniel and Ingolf, where they organized the first European CMT specialist conference in Paris, and many of you have been there as well, where we set actually ideas, concepts that I will show you in a few minutes. And they kindly asked me to make also the general conclusions and the perspectives of this meeting. So now I told to Ingolf, I'm not going to do this again, because then we take notes all the time. So that's why we will have some recordings as well. But also we have appointed some volunteers who are in the audience to take some notes of important discussions that will happen during this meeting. So that will facilitate my job and also maybe job from many others. So the first European CMT Specialist Conference aimed in Paris to actually enforce patients as partners, to partner in research initiative, clinical studies and trials and drug development. Also to try to establish something about digital communications. So we know that AI is introducing. We also know what telemedicine means after the COVID crisis, and how we can use that experience from bad times into good times for patients and researchers. Also take care of health data management. So within the European health data space, how are we going to use AI in diagnostics and outcome measurements? Then also we were aiming to boost cooperative research by encouraging interdisciplinary research teams, but also have partnership with industry and an organization active in health policies. So that's basically what we aim to do. So the European CMT Research Association was actually founded after the meeting in Paris by the former board. And the idea was to join forces of leading CMT researchers covering relevant disciplines and patient association industry. And if you look into AI or internet, you will see that there are other names of ECRA organizations, so you can read them for yourself. So this was the board, the previous board. So I really thank Ingolf in particular for leading this initiative, and also all the board members. Unfortunately, the pointer doesn't work here, but you see the yellow picture from Lisbeth. Lisbeth is a research manager that you have seen at the registration desk. She helped us, and that's not only me, but also Ingolf and also the ECRA board to arrange this meeting. So all the logistics, but also the European grant to go through all the details, what we have to do, what we have to deliver. Lisbeth has helped us a tremendous amount of work that she did for me and for the others. Applause to So how did we prepare for this conference? So there was, of course, a preparatory phase. So by inviting leading researchers and other stakeholders to join ECRA, to have an active participation at conference, including pre-conference seminars. So some of you have been actively involved in giving pre-conference seminars, but and particularly I would like to see really an active participation also here at this meeting. So please, the young scientists, don't be afraid from the older ones, and the older ones, please accept the younger ones. So that's something that we really have to work on. And then we have to identify also social health challenges, EU initiatives and research achievements, and define the sessions, the abstracts, the proposals for joint projects to prepare this meeting. So that allowed us that we prepare this nice program that you all received. All the abstracts are mentioned or listed on the website. So we didn't print the abstracts, of course, they are on the website. So you have the booklets, you have everything. So we are not going to project the program all the time, because we paid with the EU money, actually, this booklet. Then there will be also a follow-up phase. So after this meeting, the idea is that we should spread the results and our achievements among the public and health policy forums, We should also publish a report of the conference, including links to selected talks and interviews. So there will be indeed interviews here happening during this conference that will be posted electronically so that also patients can have access to it. We also have a streaming of this conference. Not everything will be streamed, but some parts will be streamed. And the idea is also to create a website. So the aim of the European CMT Specialist Conference is actually to bring patients together, practitioners, scientists, industry, and policymakers, to present research achievements and discuss new strategies according to EU regulations. And so the results will be, of course, present after this meeting, full conference, full manuscripts, full reports, etc. And I invite particularly the young scientists and clinicians to also help us in doing this type of task so that we can make CMT more broadly known to the community. Because it's a rare disease, as you all know, but many genes, many mutations, so it's common but also rare at the same time. So we have a thematic objective to improve clinical care and accelerate biomedical research for rare inherited neuromuscular diseases within the EU health space. Of course, that's why we have also two American colleagues, experts in the field, joined us at this conference, because we will never forget our connection that we had already from the past with our colleagues overseas and elsewhere in the world. So we want to have a EU-wide strategic coordination, not only for the meeting, but also scientific, medical, and patient communities, etc. And then to foster the development of more general solutions within the INMD space, so finding also therapies for patients. So we defined it in the European grant, so that was co-funded by the European Union. Maybe I should go back. So here you see the call where it was submitted. So it was a quite complex call. So in GovME we have been spending many days, hours, and maybe I should count how many emails you have sent to me to prepare this.
Don't try.
It's amazing amount of work that we did to get this project done. So there were 5 objectives, so increase awareness. And then among these objectives, we also have targets, and the targets are indicated with an arrow. So the awareness is important. We need to create guidelines, that's objective 2. And you can also read the tasks. I'm not going to read the sentence that you can read yourself. We also need engagement, that's objective 3. Engagement with pharma industry for CMT drug development is very important. Engage the industry into academic initiatives. Develop frameworks or agreements to facilitate patient-level health data sharing across borders. And also the meaningful use of AI in diagnostics, that's objective 4. And objective 5 is actually to become partners. Again, partners is all level. Patients, researchers, therapists, in a very broad sense, as you can imagine. And we wrote somewhere that we would raise that 10% in the first year. I don't know, Ingolf, how this will be translated anyway. We will have to think how we can prove that we have increased 10% of this partnership. Important for this conference is our partners. So I would like to, you can read the names of the partners that we have. So we have several industrial partners, sponsors of this meeting. The European project, the University of Antwerp, but also the Flanders Research Foundation has been supporting this conference. So I would like to give an applause, particularly for the industrial sponsors. So I made 10 commandments. So what do you need to know for this conference? So first, sign at the attendance list upon arrival every day. So we need to track that you were here every day because the EU wants to have these numbers. Also for the dinner, but that's more another aspect. The dinner we also need to know if everyone has a seat, of course, and has contributed to the dinner. Also, if you invite your partner, be sure that payment was done. Check the meeting program on the website or the booklet, so you will not have the program printed on the screens all the time, so you have the booklet. Third point, tell us if you do not wish to be photographed, interviewed, or your presentation recorded. So you have to sign up at the registration desk to indicate that wish. That's very important in agreement to the EU regulations, so we have to do that. And also some scientists may have some information that they don't want to disclose too early. So that's why we emphasize networking at this meeting to allow that. So we will also respect that wish, of course. Please upload your slides today at the registration desk or during the breaks, and preferentially before your presentation and not after your presentation. Number 5, commandment 5, leave your poster, and that's a commandment, during the entire meeting for the 2 sessions. So there are 2 sessions on 2 days, tomorrow and on Saturday, and you have to stand at your poster at the day where you are assigned. So please do it and try to invite your colleagues to your poster and explain what you are doing and what you would like to do and how you would like to improve. Because you will also be eligible as a poster, but also as a presenter to have a prize. And you will see appearing on the screens during this meeting a QR code with a voting system where you can vote on the best poster, the best presentation. And I mean the best presentation is the 10 minutes presentation, not the plenary lectures, of course. There is internet access, so every one of you has received a badge, and there is on the badge a login and a personal password. So that's also a regulation that our university does to avoid hacking and all that stuff. If not, you can always ask the registration desk to verify what is the problem for not being able to log in. Then the reimbursement. So Ingolf has sent an email, but he will talk later on again about the reimbursement, because we aim to reimburse, if it's possible, mainly the young scientists who are active. Then you will have a certificate of attendance and a questionnaire after the conference. And the questionnaire is very, very important to complete, because we will need also to know the future strategy. How do you feel about these conferences? Is it useful or not to continue? I hope it will be useful. And then the last one is, I think, the most important one. And I have a special slide for that one. And it will be immediately clear what I mean. So this is a partnership.
That's great.
So now I have a video from the EU Commissioner Olivér Várhelyi on highlights and future of the EU health policies on rare diseases. So I'm looking at my time. Yeah, perfect on time. And he will be about 5 minutes talking about these highlights. And can I ask the people in the back to check that the noise of the video is okay when I start, okay? Yeah.
Ladies and gentlemen, thank you for inviting me to speak at this second European Charcot-Marie-Tooth Specialist Conference. Some 30 million people across Europe are living with a rare condition. That's around 1 in 15 people in the EU. Their conditions may be very different, but they face many of the same challenges, like uncertainties and delays in being diagnosed, or difficulties in accessing treatment if one is available at all. And their quality of life often suffers. People with Charcot-Marie-Tooth disease are no exception. They are still waiting for effective treatments, just as many other neuromuscular disease patients are. The EU is committed to supporting patients affected by rare diseases and their families. By uniting across Europe, we can help them access the specialized expertise and care they need. The 24 European reference networks for rare diseases lead the way on cooperation, coordination, and action. Charcot-Marie-Tooth disease is covered by the European Reference Network on Rare Neurological Diseases. This network brings together health professionals committed to supporting those with inherited nerve disorders that cause muscle weakness and atrophy. These networks are true success stories. They bring doctors together to advise on the most appropriate diagnosis and the best treatment available. This is exactly why we will continue to support the reference networks under the next multi-annual financial framework within a window dedicated primarily for health and biotech under the European Competitiveness Fund, which holds more than 22 billion euros. Research into rare diseases doesn't just help small patient groups. It often sparks breakthroughs for millions. For example, studying a rare cholesterol disorder led to statins, now standard for heart disease. Work on rare genetic conditions helped create mRNA technology, which gave us COVID vaccines. Rare diseases open doors to discoveries that change all of medicine. Together with European governments, we co-found the European Partnership on Rare Diseases. This is advancing research on prevention, diagnosis, and treatment. We're developing a Biotech Act, which will also boost innovation on rare diseases. This will help, in particular, innovative products to get on the market faster and open doors for investment. On top of that, we are updating the EU's pharmaceutical legislation to promote the development of medicines that address unmet needs like rare diseases. It will also facilitate medicines development and more timely and equal access to these medicines in all EU member states. It is complemented by the Critical Medicines Act, which aims to strengthen security of supply in Europe, including also for rare disease treatment. Together, these measures represent a decisive step toward improving outcomes for people living with rare diseases. Ladies and gentlemen, improving the lives of people with rare diseases needs all of us to work together. Patients, doctors, scientists, pharmaceutical researchers, and policymakers. The EU will keep working with you to turn research and cooperation into real treatments and better lives. Thank you, and I wish you the best for a good event.
Thank you.
So that was the message from the EU Commissioner Olivér Várhelyi. And then I have the slides for the scoring, so you will see this slide appearing tomorrow, also during the dinner. So you can vote until Saturday after the poster session. And Filippo will take care of the prizes afterwards. So he will nominate those best posters. For those who have a poster, it is very important that you do your best. Why? Because you will not only get the prize, or you can get a prize, I will say like that, but you will also be kindly asked to participate in a video interview. And you will be able to also talk and see how funding can be relevant for your research. So that's something that we will have to consider. So for the young people, even the not so young people, they are invited to do this.